The CDC has provided this infographic that shows us what PPE is recommended for treating COVID-19 patients. This is not to do with the AIIR, this is just the PPE. So preferentially you would use, in addition to your gloves and gown and either a face shield or goggles, that you would use either an N95 or higher respirator, and that an acceptable alternative, if a respirator is not available, would be a surgical face mask with the face shield or goggles, preferentially with the face shield though, because it does help protect some from direct spatter to the mask itself. And then of course the gown and the gloves. I wanted to take a pause for just a moment to clarify some information about surgical masks. The material that's used in surgical masks falls into 3 levels, and these are called ASTM levels, which are manufacturing standards. And level 1, 2, and 3 all have excellent filtration efficacy equal to or greater than 95%. Their breathability is certainly better than a respirator would be, and they do have some fluid resistance, with level 3 having the most fluid resistance and level 1 having the least. And that's really the main difference between the 3 levels of surgical face masks, and these are cleared by the FDA. So respirators, such as the N95 respirator that's most commonly used in healthcare, will also filter 95% or greater of all small particles. The main difference with respirators, because even though they kind of look like a mask, so we tend to call them N95 masks, but they truly are respirators. They have to fit properly to the person's face to not allow any air to come in through gaps or openings. You know, for instance, a surgical mask, when you put it on, it's not going to form fit to your face. And there will be some risk of small particles that may be suspended in the air being pulled in under the mask when you breathe. There are some requirements though before we start wearing N95 masks that need to be addressed. Specific written programs, some training, and respirators are tested and approved by the National Institute of Occupational Safety and Health, which is a division of the CDC. And then that list that's created by NIOSH are then the ones that the FDA will clear to market, and then you'll see being offered by vendors. These both filter and provide a seal to the wearer's face. So that's the big difference between respirators and masks, is not the amount that they filter, but the efficacy of that filtration, because of it not allowing any of the air around the person's face to be drawn in around the edges of that respirator. So there's 3 things that need to be present for the respirator to really be effective. One is that it has to be put on correctly and worn all the time during exposure. So there's very specific guidelines for how to put on a respirator, and there's lots of great training videos online that you can use to see that it's being done properly every single time. For instance, this infographic shows that, you know, the lower strap goes at the nape of the neck and the upper strap goes towards the top of the head. It shouldn't be twisted or both put, you know, in the middle of the head. It shouldn't be pulled down when there still may be exposure. It has to fit snugly against the user's face to ensure there are no gaps between the skin and the seal. And the way that you do that is you do something called a user fit check every time you put on the respirator, which is not the same as a fit test, which we'll talk about. A fit check, a user fit check, is just quickly checking to make sure that you have a good seal. The respirator filter must also capture more than 95% of the particles of the air that pass through it. And those 3 things will make the respirator effective. So I mentioned fit testing. A fit test is something that's done on any type of respirator that's being used, which I think in dentistry we're using almost exclusively N95 respirators or N95 type respirators. The fit test can be done by the employer, or it can be done by an outside party, such as an occupational health clinic. They're usually doing that for all different types of workers. It's required to be done initially. So before somebody uses a respirator for the first time, there has to be a fit test. And the fit test has to be done with the make, model, and size of the respirator that that person will be using. Because if you use different ones, you know, it may fit differently and it may not seal. And this is the only way to really ensure that you have the seal. It uses an agent to check whether there's leakage around the respirator. So if you see on the picture here, there's sort of a yellow hood. It goes over the patient's head, or excuse me, goes over the person's head while they're wearing the respirator. And then an agent that either smells like bananas, tastes sweet, tastes bitter, or is an irritant smoke is placed into that hood. And then, you know, some different manipulations are made by turning the head and bending and leaning. And if the person can smell or taste or cough due to these agents, then we know that the seal is not good. The fit test kits are available commercially. You know, you can go to any kind of safety supply or even just, you know, do a Google search, fit test kit. I would say that if you've never used one and you intend to do the fit testing in your own practice, that somebody become quite expert at it by you know, reviewing the manufacturer's instructions very carefully. There's a lot of training videos online. Most of the manufacturers also have training videos to show you what needs to be done during this type of a fit test. And there's two types. One is called a qualitative fit test, and that's what this kind is. There's also a machine that'll do fit tests called a quantitative test. But this type qualitative test is fine for N95 respirators. If you were using something like a powered air purifying respirator, you know, that kind of has the whole thing that goes over your head and the air goes through a filtering machine, you would need to do a different type of test. But these are fine for N95s.